Hello everyone. I am Dr. Praveen Namboothiri. I am a nephrologist who is practicing in Kollam, Kerala. I am a freelancing nephrologist. I am now catering to about 6 to 7 hospitals in and around Kollam. I have been practicing nephrology since 2006. I'm mainly associated with Bishop Bensiger Hospital at Kollam and NS Hospital at Kollam. These are the two main hospitals that I am associated with. I'm here to speak about my experiences and provide you information about the appearance of protein in urine, what it is, what are the symptoms of protein in urine, what causes appearance of protein in urine, how dangerous it is, how we can prevent it, and how you can diagnose it and how you can treat it. So basically, my talk will be based on these small subheadings. The first thing is we all need to realize what is kidney disease. So basically, as we all know, kidneys are the filters in the body. They purify our blood and they remove the waste from the blood and keep the important nutrients and water important substances are needed in the blood are kept inside the body. So that's kidneys function every minute, every second, every hour, every day of our life. And they are very important to maintain internal homeostasis. That is, the internal balance of the body is mainly maintained by the kidneys, from temperature regulation and balance of the electrolytes in the body, balance of the blood constituents, to bone and mineral metabolism, vitamins, and I think almost every function of the body is being balanced by the kidneys. So it is a very, very vital organ. We all know that we have two kidneys, and any disturbance in the functioning of the kidneys leads to lots of problems in the body. Mainly, it affects almost each and every organ of the body. One of the main signs of kidney disease, or the main first signs of kidney disease, is the appearance of protein in the urine. Before we go to what causes protein in the urine, how you diagnose protein in the urine, we have to realize that usually in our kidneys are so efficient that we do not lose or just lose a very minuscule or very, very small quantity of protein in the urine. Hence, the appearance of protein in the urine is a very, very important and very, very subtle indicator of kidney disease. All of us nephrologists believe that urine contains lots of information. We all say, actually, we are taught to say that urine is yellow because it contains gold. That means it contains a gold mine of information. That's what we are taught to believe. And testing the urine is of paramount importance in diagnosis of kidney disease. As I told you earlier, usually protein does not appear in the urine, or it appears in the urine in very, very small quantities or trace quantities. Usual amount of protein that appears in the urine is less than 150 milligram per day. So you can just realize, you can just imagine how small a quantity appears in the urine usually. But what happens in kidney disease is that the filtration in the kidneys happens through barriers or small membranes which are known as glomerular basement membrane. If there is any damage to this membrane, which is basically the filter inside the kidneys, so if there is any damage to the filter, there is loss of various substances in the urine. As I told you earlier, protein does not usually appear in the urine, but if there is damage to the membrane of the kidney or the filter, there is appearance of small amount of protein in the urine initially. Slowly, this amount might increase with time, or with the intensity of the disease, the amount of protein in the urine increases. So when protein in the urine comes in significant quantity or significant amount, by significant I mean more than 500 milligram per day, then the urine begins to froth. So appearance of froth in the urine is usually the first clinical indicator of appearance of protein in the urine. So when there is froth in the urine, by froth in the urine I mean that appearance of froth in the urine, or urine might froth even in normal cases because of many other substances which are there in the urine, ammoniacal substances which are there in the urine, or phosphates in the urine. All these can cause froth in the urine. But a very simple way to find out whether froth in the urine is due to protein or is due to proteinuria. Proteinuria means protein in the urine. Is to see whether the froth disappears after flushing. We all pass urine, and when we pass urine, if it froths, then what you have to do is you have to flush it. And once you flush, if the froth remains in the closet, that means possibly you have protein in the urine. That's a day-to-day indicator of how you can find out or diagnose by yourself whether you have protein in the urine. So in case you have a frothy urine which persists even after flushing, that is an indicator of protein in the urine. So in those cases, what we have to do is we have to test the urine for the presence of protein. The main protein in the urine usually is albumin. Albumin is a major protein in human blood. So appearance of albumin in the urine can be diagnosed by simple tests, which is known as urine routine test. So in urine routine test, what happens is you test for the presence of albumin in the urine. And if albumin in the urine is there, it comes as 1 plus or 2 plus or 3 plus, depending upon the quantity of albumin which is present or the quantity of proteins are present in the urine. This is a qualitative test. That means you can just find out whether there is the presence of albumin or protein in the urine. In case there is presence of protein in the urine, even quantitative. Quantitative means you can find how much it is. Now, finding out how much protein is there in the urine is very important to find out different causes of kidney disease. As we all know, kidney disease can be of many types, many types of kidney disease. Clinically presentation, which can either be asymptomatic or present with swelling in the legs or with other symptoms. Now, people who have protein in the urine, once you have quantitated that and found out the exact quantity, it can be milligrams to grams. It can run up to, we have seen patients who have at least 30 grams to 40 grams also, they lose per day protein in the urine. So according to the degree of protein loss in the urine, you can diagnose different diseases. The underlining point is, or the main point to understand is, the presence of protein in the urine can be diagnosed very easily by simple tests, very simple tests which cost hardly 50 rupees, and you can find out whether you have protein in the urine, and further testing, the quantitative test to find out how much protein loss is there in the urine can help you diagnose severe kidney disease. It's very important to understand that the first sign of kidney disease usually lies in the urine. So the first sign is found out if you test urine for protein. Not only protein, actually, to diagnose kidney diseases, you can test urine to find out the presence of WBCs or infection in the urine. You can find out whether there is blood or RBCs in the urine. All these things can be tested by a simple urine routine test, which gives us lots of information about kidney disease. And mind you, these are all the first or initial stages of kidney disease. So, what are the different causes? Now, what causes protein in the urine? So, it can be, even normally you can have protein in the urine sometimes. If you have fever or during pregnancy or if you exercise a lot, all these things can cause protein to appear in the urine even normally. So, protein in the urine might not always be a disease. It can also be physiological. That means it can be a normal phenomenon. So, first you have to differentiate whether it is a disease or not. In case it is not due to a physiological phenomenon, you go towards a pathological or the other causes of protein in the urine, which can be caused by diseases. Now, the major causes that we see day-to-day basis on a clinical practice of protein in the urine, the first and foremost is diabetes. Patients with diabetes, especially uncontrolled diabetes and long-standing diabetes or insulin-dependent diabetes, they are very prone to develop diabetic nephropathy or diabetic kidney disease. First sign being the appearance of protein in the urine. So, other than diabetes, hypertension can cause protein in the urine, especially long-standing uncontrolled hypertension, or high blood pressure, which is difficult to control or gets controlled only by 3 or more drugs. The other causes of protein in the urine can be some drugs can cause protein in the urine. Any sort of disease or any disease that causes injury to the filters of the kidneys can cause protein in the urine. By injury, I mean it can be either a toxic injury like by drugs or snake bite, etc. It can be inflammatory injury by different kidney diseases. All these can cause protein in the urine. In addition to diabetes, hypertension, you have special diseases of the kidney, which are known as nephritis and nephrotic syndrome. All these diseases, they are a bit more complex diseases. Let's not go into those complexities now. But all these diseases of the kidneys can cause protein in the urine. Now, what are the symptoms of protein in the urine? 90% of patients who have protein in the urine are asymptomatic. Means they don't have any symptoms. But patients who have severe amount of massive amounts of protein in the urine, they can manifest with swelling of the feet or swelling in the face early morning. They have puffiness in the face when they get up. They can have bloating sensation of the abdomen, severe weakness because they're losing all their protein in the urine. They can have a low or a high blood pressure. They can have anemia or a low hemoglobin and weakness subsequent to that. And swelling in any part of the body, swelling can come in the lungs. So when you have swelling in the lungs, especially in advanced cases, when you have swelling in the lungs, you have shortness of breath or breathlessness. When you have swelling in and around the bowel, you can have digestive problems, you can have bloating sensation of the abdomen, constipation or indigestion, all those problems can happen. So depending on where the swelling comes or where the manifestation is, the symptoms will depend upon that. Now, as I told you earlier, diagnosis of protein in the urine, that's very simple. A simple urine test can help you diagnose the presence of protein in the urine. And urine routine, you can quantitate 24-hour samples, and there are other specialized tests to find out which protein is maximally going or being lost in the urine. These are the simple tests to find out. And whenever we test for presence of protein in the urine, we also do kidney function tests to find out what exactly is the function of the kidney, whether the kidney is functioning properly or the presence of protein in the urine has affected the kidney function also. So these are different tests. And then you also have imaging like ultrasound, CT scan, or whatever other tests, if required, they are done to assess the kidney function in those patients. I told you the causes, I told you the diagnosis, I told you the symptoms. Now, the most important thing to realize is how you can prevent the appearance of protein in the urine. First is especially we have to realize whether we have a risk factor to the appearance of protein in the urine. The first risk factor, the most important risk factor is the presence of diabetes. So in case you are a diabetic patient or in case you have high blood pressure, you have to every 6 months check the presence of protein in the urine, especially if you have diabetes or hypertension more than 5 years. Long-standing diabetes, especially uncontrolled or difficult to control diabetes, these patients, they are very prone to develop proteinuria. So these patients especially have to check their urine for the presence of protein every 6 months. That's very important. Now, when I say the presence of protein, there are special tests, especially dipstick tests, that can help us to diagnose the presence of protein in the urine even before urine routine. It comes in the urine routine. Those are the microalbuminuria tests. So patients who don't have significant proteinuria or proteinuria which appears on urine routine, you can do tests for microalbuminuria and even find out the presence of proteinuria even before the urine starts frothing, or even before you have significant amount of protein to have a 1+ on the urine routine examination. So microalbuminuria tests help us to detect proteinuria very early. So all patients with diabetes who are negative for protein on the urine routine test should undergo a microalbumin urine test once every 6 months. That will help us to understand whether these patients are prone to develop proteinuria or prone to develop kidney disease in future. That's especially for diabetic patients. Microalbuminuria tests also help us in patients with hypertension or other diseases in case you want to diagnose them early. So that is a test of microalbuminuria. Now, how can you prevent this? That's what I was up to. Prevention of protein appearance in the urine, the first and foremost is to see if you have any risk factors. In case you have any risk factors, especially diabetes, as I was telling you, that will have to be controlled. You have to control your diabetes strictly. Keep your fasting blood sugar less than 110. Your postprandial or after food blood sugar, blood sugar should be less than 140, and the HbA1c or 3-monthly aggregate of blood sugar should be less than about 6 to 6.5. That's what we call as a tight blood sugar control. This should be maintained very strictly, especially in patients who are taking drugs for diabetes. Hypertensive patients who have high blood pressure should control their blood pressure to less than 140/80, or even better if it is less than 125/75. That is what is the recommendation nowadays for control of blood pressure. Other patients who are prone to develop kidney infections of the kidney, urinary infections, or who have a family history of kidney disease, all these patients should be checking their urine at least once every year. So that's how you can diagnose proteinuria quite early. Dietary modifications also are very important, especially having lots of red meat, especially consumption of lots of red meat. They should be avoided in patients who or cholesterol-laden food. We all know that oily food or cholesterol-laden food are very dangerous for the blood vessels, for the normal circulation in the body. So all foods that contain or are high in cholesterol should also be controlled in our diet. Along with this, along with diet, as important as diet is to exercise daily. By exercise is meant at least 30 to 45 minutes of brisk activity every day. It can be running, it can be walking, any sort of exercise that you are comfortable with any time of the day. At least 30 to 45 minutes of brisk exercise, at least on 5 days a week, is very important because it helps in the circulation, it helps in general well-being, it helps you to maintain your basal metabolic rate, it helps to maintain your BMI, prevent obesity, and many other things. As we all know, the effects of exercise need not be explained over the in detail. In addition to that, lifestyle modifications, diet, exercise, and absence of alcohol and smoking, sleep, to have proper sleep. All these things are very important in our lifestyle modifications so that we can prevent the appearance of risk factors which can later lead to appearance of kidneys. So that's how we can prevent kidney failure. How we can prevent. Now, what do you do in case you have protein in the urine? Not to worry, appearance of proteinuria does not mean that you've lost everything or the kidneys are totally damaged. In most cases, it just means that it's an indicator of more severe things to come. Patients who have proteinuria should and significant proteinuria should take treatment from a doctor. We have many drugs which can help to reduce the protein in the urine. The first and foremost being the control of blood pressure and blood sugar. Other diseases of the kidneys which can help, which can cause proteinuria. Those diseases need to be identified either through lab tests or by kidney biopsy or by other tests. And those kidney diseases, once they are identified, they need to be treated according to the cause of the kidney disease. Diet in patients with proteinuria. I'll just tell you 2 minutes about diet in patients with proteinuria. That depends upon the degree of proteinuria. So we have patients who lose. I told you anywhere between 500 milligrams to 1 gram, and we have seen patients at 20 to 40 grams. They lose about 20 to 40 grams. So depending upon the amount of protein you lose in the body, you have to make sure that along with taking medicines to decrease the loss of protein in urine, you should be maintaining a healthy diet. The protein in the diet is also not compromised. The main and the most important and the best source of healthy protein is the egg white. So egg white is the best source, and fish. These are the two sources of best protein available to us. If you are a vegan, if you are a vegetarian, soya bean or soya chunks, they provide. Kidney beans, they also provide a very good source of protein. So these are the foods that basically, just a few examples of foods that help you to replenish your protein stores and good protein stores. So this is in a nutshell of appearance of protein in the urine and proteinuria, what you can do to prevent it, and how you can diagnose it, and how you can find it out or guess that it is there or protein is there in the urine even before the appearance of overt symptoms, and what you do in case you have protein in the urine, and different tests that can be done to diagnose it, and just a small description about the treatment.